our Corporate Anchor Roundtable is an opportunity for us to learn how our colleagues and the institution overall is serving the needs of our communities beyond usual medical care. I think by now many of you know that I am passionate about our organization being an anchor institution in that it is concerned with things far beyond the conventional platform or menu of clinical care. People cannot be healthy if they're chronically unemployed and cannot be healthy if they live in an environment where there is insufficient economic development. Environments like those go stale and otherwise fall into disrepair and further burden those who live in such areas with lives that are not enjoyable and certainly not healthy. I am very proud of our organization for having led the way in establishing what I consider to be the need for healthcare institutions like ours to be anchor institutions, to go beyond just the simple duration of time of existence in one place and to truly become integrated in our communities. And I would suggest something that I know you all know, but we need to keep top of mind. Anytime we do something in our community, anytime we start an initiative or make a contribution, irrespective of what that initiative may be, we are further, I hope, building trust in our community. We are expanding our relationship with those who live in our communities, and that inures to the benefit of all those who live in our communities, as well as ensures, as best we can, not only the viability, but the prosperity of our organization. For those of you who may have read the pre-meeting material, I was struck, and I must say I wasn't particularly happy with one of the articles, which implied criticism for those of us who are attempting to address the social determinants on an individual community person basis. And it rightfully called for more policy making across populations to ensure that the social determinants are in fact addressed. I have to say I have no quarrel with the goal, but I am not particularly fond of the notion that there's a strong suggestion that we ought to stop trying to do it individually and insist that population-wide policy gets adjusted. I wish we could do that. I wish we had the opportunity and the authority to legislate the kinds of policies that would make some of our social platform unnecessary. For those of you like I who've been involved in conversations with people from foreign lands where they have national health services, we are frequently asked, why is it that America spends so much money on healthcare and the results aren't as good? And my standard answer, with some explanation, is that every country that has a national health service has a greater social platform supported by the government. That, frankly, is the message in that particular article. We can do very little about that. We advocate for that, and we try to get policymakers and elected officials to address that. But for the moment, until all that gets done, our role as an anchor institution caring about the total lives of the people who live in our communities is imperative. At least I think it is. And so I want to thank all of you for that which you do in that regard and how you support not only our mission in general, but specific our anchor institution profile. And I encourage all of us to continue to do that as we learn more about how we can help our communities in that regard. So again, thank you all for participating. And Diana, thank you to you and your team for putting this together.